This is my day as a Parkinson patient. I can't wake up from my bed easily anymore. Getting out of bed feels like pushing through glue. My pen moves, but the letters look like strange symbols. When I am tying my shoe, something once automatic, now takes forever. My hands tremble like leaves in the wind.
And today I will represent the Parkinson's disease, a complex and progressive disorder of the central nervous system that primarily affect movement. Common symptoms include tremors, muscle weakness, slow motion, and posture disability. In advanced stage, it can lead to service. Now I will continue. What is limitation disease? Parkinson's disease is a chronic, progressive, degenerative neurological disorder that diagnosed due to lifetime is very over time is affect the brain and nervous system is classified as a moment disorder which is four hallmark symptoms. Tremors is one usually shaking a small muscle, and the second is muscle rigidity, the stiffness and resistance to movements, and third is bradykinesia, the slowed movement. And the last one is posture inability, difficult with balance and condition like you walk on the road, you will lost balance, you will be for that. It's important to note that Parkinsonism refers to a group of disorder with similar symptoms. Not all cases Parkinsonism are caused by PD. Other conditions like stroke, head injury, or certain medication can mimic its effect, making this diagnosis challenging. So lastly, Parkinson's disease is more than just a moment disorder. It is a window into the intricate working of the brain. Understanding how the dopamine, neuron, and brain region interact help us get the challenge of PD is the importance of continued research. Thank you.
Now that we understand what Parkinson's disease is, let's look at the factors that can lead to it. The exact cause of PD often unknown, but two major factors are the genetics and environment. Some rare cases are linked to mutations in genes like SNCA, LRRK2, and Park7, which affect how brain cells handle proteins and stress. Environmentally, exposure to pesticides, heavy metal, or even rural living with well water can raise the risk. But the biggest risk factor by far is the age. The chance of developing PD rises sharply after 60. These risk factors can eventually lead to symptoms that affect both movement and other body function. PD symptoms fall into two categories, which is motor symptoms and non-motor symptoms. Motor symptoms include resting tremors, slow movement, muscle stiffness, and poor balance. And non-motor symptoms, which sometimes appear earlier, include constipation, depression, and loss of smell. Diagnosis is based on medical history and neurological exams. There's no single test that can confirm PD. However, scans like the DAT scan can help rule out other conditions and support the diagnosis. Parkinson's disease progresses differently for everyone. Early stages may only affect one side of the body. Over time, symptoms spread to both sides, balance becomes harder to maintain, and daily activities require more help. In the later stages, patients may need a wheelchair, and non-motor issues like hallucinations or cognitive decline can be even more disabling than movement problems. Medications like levodopa can improve symptoms, but they can't stop the disease from advancing, which is why research into better treatment is so important.
Thank you, Yin, for the detailed explanation. Hi all, I'm Rinsha Sivakumar, and now let's move on to something important, like how we actually treat and manage this condition. When it comes to medical treatments, the main goal is not to cure Parkinson's, because unfortunately there's no cure, but to control the symptoms and help patients live as comfortably as possible. First up is medication. The star player is levodopa, usually paired with carbidopa. Together, they help the brain make more dopamine and also reduce side effects like nausea. Then we have dopamine agonists like Parkison and Rapidol. Think of them as dopamine imitators. They trick the brain into thinking it's getting more dopamine. Also, MAOB inhibitors slow down the breakdown of dopamine, and COMT inhibitors make levodopa last longer in the body. Parkinson is not just a movement, it also affects mood, sleep, and thinking. That's why doctors prescribe antidepressant or even mild antipsychotic like quetiapine for non-motor symptoms. If medication alone is not enough, we move to deep brain stimulation or DBS. This is like a pacemaker for the brain. Electrodes are placed in certain brain areas to control abnormal signals. And finally, therapies, which is physiotherapists, keep the body moving. Speech therapists tackles voice and swallowing issues. Now, aside from the hospital-based treatments, there's also a whole range of lifestyle and alternative options that can make a huge difference. First, exercise. Exercise is key. Activities like Tai Chi, yoga, or even dancing, especially tango, can improve balance and coordination and plus mood. Second, healthy eating plays a role too. More antioxidant, omega-3 and fiber to keep the brain and body healthy. And for those on levodopa, timing protein intake can make the medication work better. Also, like mind-body practices like meditation, mindfulness, and deep breathing help with stress and sleep. Some patients try massage, acupuncture, or music therapy, but the evidence is mixed. Many say it helps them feel better.
Hi, let's talk about statistics and prevalence. The global burden of disease study in 2011 estimate that Parkinson's disease affects 11.77 million people worldwide. This represents a remarkable increase since 1990, which is 155% higher. What is even more concerned is that if the trend continues, there may be more than 25 million people living with Parkinson's disease globally by the year of 2015. It is now considered one of the fastest growing neurological conditions in the world. Let's talk about the regional trend. East Asia currently shows the higher regional increase in Parkinson's disease case, with an average annual growth rate of 3.17 to 3.547. In countries like China, Japan, and South Korea, the age standardized parent rate, or ASR, has reached 243.5 per 100,000 people. Meanwhile, in Central and Eastern Europe, the trend is stable or even decreasing, which highlight the strong regional
Hi,
difference.
it's me again. Now I'm going to present the personal
Now
research question.
looking
Actually,
at
the report
our
have four. I
country
selected two questions because
Malaysia,
it's not enough time. So the
our
first one is,
precise
can you live a long
national
life
data
with
is
Parkinson's
still
disease? Yes, actually
limited.
can. Many people with
However,
Parkinson's disease
based
can live
on
long life with
global
no problem.
burden
But
of
the PD
disease
is
trend,
progressive
we
condition
are
that affect a
seeing a
woman
growth
can
pattern
live a
similar to
complication.
high-income
It's not
East
considered
Asia.
better on its own.
In
It's proper medical care,
2018,
lifestyle
we
adjustment, and
estimate
support.
around
Individual can
20,000
manage
cases
symptoms and maintain
nationwide.
independent for
By the
many
year
factors like
2040,
early
this
diagnosis,
number is
access
projected to
treatment,
reach
and overall health rate,
120,000 cases,
a big role in
a
life expectancy.
five-fold
So the
increase
second one, who
in
is
just
more
over 2
likely to
decades.
develop
This data
Parkinson's
is
disease?
supported by Dr. Oi Pei
Several factors increase the risk
She is having an
for
interview with Malay May in
developing PD. Is
2019.
as most people, the first age, most people are diagnosed after
Comparing
age
global data
60
with
years old.
Malaysia,
So the
in
general, the men
2021,
are
globally
slightly
there
more
were
likely to
11.77 million cases,
develop PD
with an
than the
ASR
women.
of
And the third one is
138.6
family
per
history. Having a close
100,000
relative with a
people,
PD, many rise
and
your risk.
an annual
So the last
growth
one
rate
is
of
environment exposure, long-term exposure
0.52%.
to
Malaysia
persistent
estimate
disease
ASR
or
is
toxins may
150 to
contribute.
200 per
So still PD can
100,000
affect anyone,
cases,
regardless
which are
of
already
background
higher
or
than
lifestyle.
the
Thank
global
you. This is my
average.
part.
And our growth rate is 2 to 3% per year, much faster than the global pace. The gender ratio is also slightly different. Globally is about 1.4 to 2 male for every female, while in Malaysia is closer to 2 to 1. The higher rates age group remain consistent worldwide, which is 60 years and older.
Hi, I'm Misha, and I will be presenting the research and development for found in the article regarding Parkinson's disease. The first article is about researchers at UCLA have created a diagnostic pen that looks exactly ordinary but detects early Parkinson's with over 96% accuracy by analyzing handwriting. It picks up tiny motor changes invisible to the eye by converting writing pressure into electrical signals. Next, I will highlight a groundbreaking study from Stanford Medicine on halving cell death in Parkinson's disease. On this article, researchers focused on the LRRK2 enzyme, which becomes overactive in many patients due to genetic mutation. This overactivity destroys primarily cilia, tiny cell structures vital for receiving survival signals, leading to neuron death. And using a drug called MLI-2, they inhibited LRRK2 activity and unexpectedly restored cilia in mature brain cells, overturning the belief that such regrowth was impossible. Even more fascinating is that these cilia followed a 12 hours growth cycle, hinting at a biological rhythm that could be harnessed for treatment. The last article is about Parkinson's patients now have a new FDA-approved tool to help manage symptoms. So Medtronic's brain sense adaptive deep brain stimulation system. Think of it as a brain pacemaker. Electrodes are implanted in the brain to regulate neuron activity, but unlike older models that gave constant stimulation, this one adjusts in real time. It reads brain signals, detects when motor symptoms need correction, and fine-tunes simulation, so much like adjusting blood pressure medication based on actual readings. This precision is possibly thanks to decades of research pinpointing the brain signals tied to Parkinson's motor problems. Thank you.
Thank you, Xiong. And now let's wrap up everything we have learned today. So to sum it all up, Parkinson is a progressive brain disorder that affects movement, mood, and thinking. It causes a mix of genetics, environment factors, and aging. We have medical treatments like medication and DBS to control symptoms, and alternative approaches like exercise and therapy to improve daily life. But these treatments can lose effectiveness over time, and we still don't have cure yet. The good news, new research like smart DBS, enzyme blockers, and early detection tool is giving us hope for better, more personalized treatment in the future. At the end of the day, the best approach is teamwork, combining doctors, therapists, families, and patients themselves to improve quality of life and slow down the disease. And with that, we can see that while Parkinson's may be a lifelong challenge, science and care strategies are moving us closer to future where living well with Parkinson's is not just possible, it's the norm. Thank you.